A record number of people have not been able to work due to ill health. We're going to have a look at the numbers through an article from the BBC News, originating these numbers from the Office of National Statistics. Let's go. Good morning, good afternoon, good evening, guys, wherever you are in the world. This is REGANELITE here, and we're going to be looking at the record number of people not working due to ill health. This, of course, is tied when it comes to the whole National Healthcare Service, which is struggling right now with the lack of investment in there, and obviously with the strikes that are also taking place when it comes to the nurses. This is also having the impact on it as well. So the number of people not working in the UK due to long-term sickness has risen to a new record. The official figures show the Office of National Statistics says more than 2.5 million were not working because of health problems. There has been a rise in mental health issue in younger people, the ONS says, as well as back and neck pain, possibly due to home working. The latest jobs data shows that a rise in part-time and self-employed workers helped to push up the employment rate. The number of job vacancies fell again as firms hold back on recruitment, although the level still remains high. The ONS figures which show that the squeeze on pay remains, with increase in regular wages failing to keep up with the cost of living. Mental health, simple illness, all these things, if you're not getting the health, the care that you need, unless you have lots of family and friends, you really do struggle, especially when it comes to mental health. I believe it's mental health awareness month as well. People need support, and the fact that we're just not doing enough at all, and the government are kind of sitting on their laurels. Obviously it seems the intention of the Conservative government is to privatise the National Healthcare Service from the direction that it appears to be going. But I digress. Speaking to the BBC's Today programme, Darren Morgan, Director of the Economic Statistics at the ONS, said that since the COVID pandemic started, there are well over 4,000 more people outside the labour market due to ill health. That means we are now at a record level of comfortably over 2.5 million. 2.5 million sitting there. If they got the treatment they need, there's a missing workforce. There's a missing workforce. They say you've got to get people back into work. Well, you've got to give them the healthcare they need. Healthcare is one of the pillars of society. People can't work if they're not healthy, are they? He added that an increase seen in conditions related to mental health, particularly in the young. There was also a rise in number of people having musculoskeletal issues, so problems connected to the back, neck, and back. I've had back issues, so I know what that's like. With some theories of the increase in home working contributing to that. We've also seen an increase in the catalogue that includes post-final fatigue, so perhaps long COVID is having an impact. Yep, we don't talk a lot about the long-term impacts of COVID-19 as well. There's some people having long-term impact on that as well. So here's a bit of a graph just to kind of the long-term sickness highest on record. Obviously it's shot up, but the problem is there's not been a dip. And you would think that after the pandemic there would be a dip of some sorts. It's interesting to see other charts in relation to other European countries if they've dropped, because I imagine they would have been due to the way our NHS is being run and budgeted at the moment. The ONS figures show that the employment rate edged up to 79.5% between January and March, helping more part-time employees and self-employed workers. The unemployment rate also rose slightly to 3.9%. The ONS said these changes meant that the number of those working nor looking for work had continued to fall. The number of people on employers' payrolls dropped in April, the first decline in more than 2 years, although ONS said this was an early estimate that could be revisited later. The number of vacancies also fell for the 10th consecutive period, with the ONS saying that uncertainty about the economic outlook means that firms were holding back on recruitment. Workers' pay increase are still being outstripped by rising prices, the latest data shows. Growth in regular pay, which excludes bonuses, was 6.7% for the first 3 months of the year. However, ONS said that there were price rises are taken into account. Regular pay fell by 2%. Pay growth in the public sector was 5.6%, which was the highest rate since 2003. The number of working days lost to strikes rose by basically over 500,000 in March 2023, up from 3,032 in February, with the walkouts in the mental and health education sectors accounting for 4/5 of the total. Yeah, if they had dealt with the strikes, again, numbers would be much, much different. The Chancellor, Jeremy Hunt, said it's encouraging that the unemployment rate remains historically low, but difficulty in finding staff and rising prices are worrying for family and businesses. That's why we must stick to our plan to halve inflation and helping families with the cost of living while delivering our childcare reforms and supporting older people and disabled people who want to work. You're not doing anything about it. Shadow and Work Secretary Jonathan Ashworth says, today we see yet more evidence of this Tory government is a drag on the British economy. Family finances are being squeezed to a breaking point by a further fall in real wages. Fewer people are in employment than before the pandemic, and the number of people out of work due to long-term sickness has reached a record high. Absolutely it has. People's mental health, people's ill health, when you get sick or you're not feeling well, you need to have that treatment, and you need that breather to be able to fix yourself up and go back into work. Now, this is having, it's all chained, it's all linked. When people are not well and they end up being out for a much longer term than they wanted to, that's one less worker in the sector. That's one less person not getting their wage package. This is tied into the video with statutory sick pay as well. When people are out at no fault of their own, not getting money that they need to be able to survive, and it all spirals out of control. It's all interlinked, as I've said. Not having, if you're stuck at home and not getting that sick pay, people don't want to stay at home. People would rather work. People want to make their living. Most people, I would say, not everyone, but with a national healthcare service crumbling, pretty much on its knees, as they say, and you have a lack of, and we're going to be getting, and lack of medicine, lack of healthcare. It all ties in, and in effect this hurts the economy. And we're not even talking about Brexit here, guys. We're not even talking about the damage that Brexit is causing. But these are very worrying statistics, that is to say the least. We need to look after people. We have to look after each other. That's what really matters more than anything. So let me know what you guys think in the comments down below. Let me know your comparisons to other countries. Obviously, I always find that fascinating, because we're all human beings and we all need to be looked after. Mental health is a real thing as well. If you have it out there, don't be afraid to talk about it as well. Like, share and subscribe, and as always, take care, guys.